This is a new week, and Dr. Charles Vilfort will be talking about flu season and intestinal flu. There are two different cases because flu season usually is with us in United States between September, October to February, March. But some people will say that start in September and finish in May. And with the worst case scenario usually between December to February. The flu season in other countries like the Caribbean, like Haiti, can be all year. But in United States, usually we have two cases. That means that we have 2 times a year. We have the flu season 2 times a year. But based on what CDC said, CDC is the Center for Disease Control in United States. They said this year they start to register cases of flu earlier than expected. And they also said that could be because of what was going on in the past 2 years with coronavirus. When you ask me to define flu, I will say the word flu is a short way or an abbreviation for influenza, characterized by coughing, sneezing, headache, sometimes fever, and throat pain. You have pain in your throat. But when you have the flu, that stay for 1 to 3 days most of the time. But some people can have it for shorter period of time and others for longer period of time. But I don't know if you remember in the past when I was talking about Chinese medicine, I mentioned the name of Doc Hay. At the end of the 19th century, they need in California workers for the gold, and 40,000 Chinese came. But when they came, guess what? They didn't leave behind them their Chinese traditional medicine. And this is one of the reasons why in 1918, when we have the Spanish flu pandemic, they surnamed Engineer Hay, Doc Hay. Why? It treated a lot of people with Spanish flu and 0 death, different from other health practitioners who registered between 15 to 20% of death. Also, we have to remember people who have weak immune weak immune system are more easily getting the flu season. And if you have some health condition like diabetes, like immune system disorders, you can get the flu season more easy than people who are healthy. Otherwise, strong immune system, less possibility to have flu season. Weak immune system, more possibility not only to have flu season, but to have the worst case of flu season because you can be hospitalized and stuff like that. This is one of the reasons why the CDC recommend good personal hygiene regarding flu season. What that means? If you are helping or you are assisting someone with flu, you have to use gloves, and you can use gloves, sorry, and also wash your hands before and after, before you eat also. That way you can avoid to catch the flu season. But it's not a zoonosis. It's not a zoonosis. And zoonosis means what? This is the transmission of disorders from animal to human. And flu season is not part of that. But I have also to tell you, you have flu in some animals like birds and pigs, but they are not the one who transmit the flu season to human. You have that by contact with people who have the flu season, or even they don't have it, but they have been in contact with the germs already, they can pass it to you. But I know tomorrow is Thanksgiving, and I could say it's turkey party. It's turkey day. Some of you start to prepare or to know where they are going to eat their turkey tomorrow. And some of you will be preparing their turkey tomorrow. But what I have to tell you is go by what CDC said. Good hygiene to prevent intestinal flu. But intestinal flu and flu season are totally different. Why? Because flu season attack your respiratory system, and intestinal flu, this is a gastroenteritis. That means where you have inflammation of your stomach, but it's called intestinal flu. And intestinal flu usually in adult is transmitted by norovirus, and in young children by rotavirus. And also, when you have intestinal flu, you can have diarrhea, vomiting, nausea. In some cases, you can feel weak, pain, but usually that attack your digestive system. I remember very well 3 or 4 years ago, I was in Florida and someone approached me to say, how come I am sick? Because I have a strong immune system. And I have to explain to that person, by the fact you have a strong immune system doesn't mean you cannot be sick. You cannot have or flu season or intestinal flu. That means you could still be sick, but the possibility to get it is less than people who have weak immune system. And even you have it, the symptom could be less, could do less damage on you, but doesn't mean because you have a strong immune system you cannot get sick. And when I was talking about virus. When you have viral infection, it's not recommended to take antibiotic. Why? It's because of the characteristic of the virus. Usually, viruses, they need a complice to reproduce themselves. It's totally different from bacteria who can do that by themselves. This is why bacteria work with antibiotic work with bacteria but doesn't work with viral infection. And talking about antibiotic, that was discovered in 1928 by Alexander Fleming, and at that time it was considered and is still considered as one of the biggest discoverer in medical history, because at that time they really need antibiotic to treat some infection. And today I have to go by what CDC has been recommended for flu season. If you are 60 years old or older, the CDC recommend you to get your flu vaccine. But I have to tell you, it's not the only way to prevent flu season. You can do that by using some herbs. You can do that by using some herbal supplement, and you can do that, like CDC said, by using good hygiene. When you have the intestinal flu, you can have difficulty to sleep. Why? It's because you have to throw up, you have to go to the bathroom very often, and that way you have no time to sleep. And by doing that, you can become dehydrated. This is one of the reasons, if you have intestinal flu or season flu, it's flu season, it's good to drink a lot of fluid, because if you don't, you become dehydrated, and if you become dehydrated, you could have to go to the hospital, and that is not something we would like you to do, and more specifically tomorrow, when is the Turkey Day. I would like you to enjoy your turkey, but remember, good hygiene, that means wash your hands before and after you eat. And if you are in contact or you are assisting someone with intestinal flu or flu season, remember to take care of yourself by having good hygiene. Because if you don't help yourself, no one will be able to help you. Tomorrow, enjoy your turkey, but I will see you for another presentation in another week. Dr. Charles Vilfort, thank you.